Today we're in a system that rewards volume rather than value, and the advantage of a bundled payment type approach is that it essentially is designed in a manner to pay for the care that's needed to execute on an episode of care. And by including appropriate incentives and warranties around quality in those payments, you actually reward value delivered by the providers themselves. In some instances, we've actually found where the fee-for-service system does not reward a high-performing system. For example, in the area of substance use disorder. That's an area where we're looking at new models of reimbursement that are more conducive to the initial treatment and the ongoing support of people with those conditions. How purchasers select health plans today and how we ultimately need to select health plans can be two different things. Today, it's largely driven on two factors: their administrative costs and the discounts that they're receiving from providers. When the evaluation is done by consulting firms, those tend to be the dominant factors in the performance. I think increasingly we need to get to working with health plans that are more progressive in how they are engaging with providers around value-based reimbursement, around the support with consumers, and the downstream impact on outcomes and value. That's a little bit more difficult evaluation, but ultimately I think that's how health plans can distinguish themselves from each other.